Good morning, everyone. Dr. Dan Graham coming right back at you with Dr. Alan Bradford from Downtown Gilbert Healthcare. Hey, and today we're going to be discussing the patient that we see in and out every single day, and you might be that person, but we're talking about a male or female who is feeling run down, feeling stressed, feeling low energy, feeling low libido, feeling like you got brain fog. You're trying to work out, but the body composition is just not functioning like it should. Where you might be carrying a little bit more fat on you. Also, you're not recovering. You get an injury, and it just feels like it hangs around. So, Doc, discuss the subject of what are the advantages of hormone optimization and peptide therapy.
Awesome. Thanks, Dr. Dan. Yeah, today we're talking about hormones, and we're talking a little bit about something called peptides. So hormone optimization, what does that mean? Some of you may have gone out there and had hormones checked, had maybe a blood test done, or various other things, and the doctor comes back and gives you your lab printout and says, hey, everything is quote unquote normal. Well, when it comes to lab values and lab printouts and everything, I'm not going after normal. I'm going after optimal. So somebody might have, a normal thyroid level, right? But is that an optimal thyroid level? Is that in a range where we're starting to see really good health, really good results? Hormones specifically definitely have optimal levels. And so by doing proper testing, by interpreting that testing correctly, we're able to see maybe are there opportunities where we can tweak some things and get you feeling really good. Not normal, but optimal. Optimal levels of testosterone that can promote muscle growth, promote body fat loss, that kind of stuff. Optimal levels of progesterone and estrogen for females help identify maybe risks for cancers, things with fertility, your monthly cycle, that kind of stuff. If your hormones are in optimal levels, then all of that can function a lot better.
Now, Doc, I have used the peptide therapy in order to recover from a number of injuries over the years, and that's kind of how we met. And we'll kind of get into that later. But peptide therapy has been around for a while, but it's not readily available with medical doctors that just aren't up on this subject. So why don't you go through and explain the advantages of peptide therapy?
Absolutely. So peptides, this is kind of an up-and-coming way of approaching a patient's health, right? So peptides, what are they? Peptides are little tiny building blocks of protein. And so there's dozens of peptides that have been isolated and starting to be used by physicians to help promote healing, to help promote optimal levels of hormones, including growth hormone, to help promote gut healing specifically. There's one that I've been using with patients to help with that. There's different peptide formulations that can help with libido, that can help with mood, anxiety, depression, that kind of thing. So peptides are an exciting way to address individual patients where they're at. And they can be given in different ways, injectable, by mouth, that kind of thing. But it's just another tool in my tool belt to be able to get you feeling really good.
Now, Doc, how about when we're talking about growth hormone release? Now, I've been on Sermorelin. There's other ones that are out there, but what's the advantage of getting on a peptide that will cause a growth hormone release?
Sure. So growth hormone, this is a hormone that's present in pretty high amounts when we are growing, through puberty and all that kind of stuff. As we get older, that tapers off. We don't have to grow taller necessarily anymore, that kind of thing. But growth hormone still has lots of benefits. Benefits for healing, benefits for recovery, especially if you're in and out of the gym all the time. So by taking a peptide that can either increase the amount of growth hormone coming out or increase the frequency of how often it comes out, you can encourage those kinds of things like healing from wounds, healing from joint damage, that kind of thing. So it's exciting.
Now, and also with women, I've noticed that when women get on the growth hormone releasers, we not only see like a change in their skin tone, where I'm getting mentioned that wrinkles are starting to lessen, but also because growth hormone will cause a rapid cell division, we start to see hair growth, hair become stronger, and also nails grow faster. Fascinating stuff.
Yeah, absolutely. Yeah, so these peptides, they work what we call systemically. So really, we probably don't know all the benefits yet of certain peptides. We can isolate a few things that start to improve, but since they're used throughout the body in multiple organ systems, multiple types of tissue, we start to see just overall benefit.
Now, this is how kind of we met, but we're talking about joint healing. And as patients start to get older, they notice that injuries are hanging on a little bit longer. I had a patient that went on a peptide, and he was trying to avoid surgery. He was, achy all the time, having trouble hiking, having trouble working out. You had put him on a peptide, and that had actually, in about a month, he was fully functioning, no pain, and that was probably 4 or 5 months ago.
Yeah.
So, Doc, why don't you? What are there some different specific types of peptides for joint health?
Absolutely. One exciting one that I've been using with patients is something called BPC 157. So this one is specific for like tendon and connective tissue repair, and also gut healing. And maybe we can come up with another video specifically talking about that one, because that's exciting. But tendon and joint repair is something that we find with this particular one. So that's, I think I know the patient you're talking about, and that's one of the ones that we used with him. He took it for about a month and really noticed a lot of results and a lot of improvement within a month. In fact, I was talking to him, and he said he almost like didn't realize how much had changed. He was walking up the stairs one day, and he's like, "Oh, this doesn't hurt anymore." And so it kind of crept up on him, but happened quick.
Now, the last one is libido, male and female libido. Now, there are some peptides out there that can also affect libido as well, correct?
Absolutely. Libido, for sure. And then also just overall mood. There's certain ones that are effective with anxiety and depression. If that's off, makes it really hard to want to get into the mood of, being with the one that you love. So libido can be enhanced. Muscle healing, joint healing, gut healing. These things are exciting, and I'm excited to use them with my patients.
Great, Doc. Thank you very much, and we will talk to you soon.
Yep.